on the News Channel 5 network. This is OpenLine.
Good evening, everyone. Thank you for joining us for OpenLine tonight. It's such an important topic that we're going to spend the next hour on, and I hope that if you have questions, you will call in. We are talking about the Affordable Care Act, and the deadline is this Saturday to sign up for coverage for next year, for 2019. I have two wonderful experts to answer your questions tonight. They are waiting to take your phone calls. Let me introduce you to our guests. We have Tony Garr from the Tennessee Healthcare Campaign. Tony, thank you for being with us. And Mary Moore coming back in from Family and Children's Services. You know, anytime we talk healthcare insurance, people's eyes sometimes start to cross. It is so confusing. It can be so stressful. And for a lot of folks, this can be a make or break decision for their family when it comes to their finances. I do want to invite you to call in tonight. The number is on the screen. 615-737+ is the number to call. We will get those calls lined up, and we will take just as many as we can tonight. But Mary and Tony, I want to start just talking about the big picture for 2019. Are there significant changes going into next year that people should just know about from the get-go?
Good question. Mary?
So one unique thing about this year, you know, every year we've had some carriers leaving the marketplace and new carriers coming in. This is the first year where we don't have any carriers who have left. So this year, truly, if you sign up through the ACA, you're happy with your plan, you're happy with your carrier, that plan or a very similar plan from the same carrier will still be available. That being said, we also had two new carriers come into the Tennessee market. So there's more variety, there's more choice than there has been in the past few years. So we encourage people, even if you are happy with your plan, come back, look again. If maybe you looked in years past and didn't find anything that suited you or felt like the options were unaffordable, come back again this year. It's a whole new year. There's new plans available. You never know. So always encourage people to come and take a look.
And who is the Affordable Care Act for? I mean, I know it's for all Americans, but really who fits the bill for this one?
Well, I mean, one way to look at that is that you know, if you work with a large employer, you likely are going to be offered health insurance, and you'll be able to get health insurance. And many small employers do that too. But if you're self-employed, if you're a single or a married couple with no children, and you're self-employed, you're working on your own, it's likely that you have to go to the individual market to purchase health insurance. That's where our niche is. So, you know, if a person actually has individual coverage, they can drop that coverage and sign up for the ACA. So many times the individual coverage, it may not cover all your pre-existing conditions. It may have limits, whereas the ACA, one of the things about the ACA, there's no pre-existing conditions. They don't ask any medical questions. There's no lifetime limits. There's no annual limits. And so it's actually a good comprehensive plan.
Is there a penalty anymore for folks who do not want to sign up?
Well, I'll be there.
So for folks who were out without coverage during this past year, 2018, there will still be a penalty when they file their taxes this coming up tax season. But for folks who don't sign up during this open enrollment, if they choose not to, there's no longer a monetary penalty that will be assessed in 2020 when they file their taxes for 2019.
We always have to remember we're going back for taxes, but looking forward to signing up for health care. So that is one,
where it gets tricky.
One area where it gets confusing. If you are thinking about signing up for the Affordable Care Act but are just kind of burdened by this process, I want you to grab a pen and piece of paper. We're going to be giving you a very important number throughout the night. This is not the first time I'm going to give it. I'm going to continue to give it. But here it is. 844-644-5443. This is such a very important number. Tell me what happens if people call it.
Okay, they call that number, and we're going to ask them to leave a message. And we're going to say within 3 hours they will get a call back. And they'll get a call back from someone who's trained, someone who understands, you know, are they calling because they need to get their kids on TennCare, or do they need to enroll themselves in the ACA? Do they need to renew their coverage? So they'll call back for different reasons, and we will actually, from there, these volunteers have a electronic calendar or scheduling system, and they're going to connect them with many other volunteers, many other navigators, and set up appointments. So in our system, we have appointments at many of the libraries here in Nashville and at other locations, and this is both Hispanic as well as English, and so they can set up an appointment. As soon as they do that, the navigators will get a notice immediately that they're going to have this appointment with this person on this day, at say Friday at 3 o'clock or whatever it may be, and the place. And so it's actually a pretty nice little system that we have worked out, and we're cooperating together to make it work.
And so people can either schedule a face-to-face when possible, or a phone interview, whichever works best. And you're telling me here on Tuesday night, with the deadline on Saturday night, this is still doable.
Yes. Yes, it's still doable.
That's pretty incredible.
We actually have some really very skilled navigators and volunteers. I think most of Mary's team have been working on this maybe for 4 or 5 years. They have lots of experience.
Many have been doing this since the first open enrollment, and this is the 6th open enrollment.
Wow.
I can't believe it. But it is here.
What kind of questions should you be prepared to answer when you sit down or you have that phone call with the navigator, and what kind of documentation do you need to sign up?
So the navigator can walk them through the process, but one thing that's really helpful to consider is your current financial situation, and then looking forward to 2019.
Okay.
As you said earlier, when we're signing up on the marketplace, they're asking you to make your best estimation of what your income will be in the coming up year, which can be a little difficult, especially if you're self-employed, which is a majority. Many people who do sign up on the marketplace are self-employed, or maybe they're working a couple part-time jobs and their income varies a little bit. But if they can sit down and think about that before the appointment, that's helpful. And then the navigator can help you go through that a little bit more and ask some questions to try to nail something down, and explain the implications of what happens if you underestimate your income, what happens if you overestimate your income. So we can explain that so that everyone knows what's going, can make the most informed guess, basically. Another thing to think about is if their employer does offer them coverage, they want to have that information. So sometimes their employer offers them coverage, but for whatever reason, maybe they declined it, and now they're looking to go on the marketplace. So what coverage their employer offered them is going to be very important. So that's something for them to think about. If they've ever signed up on healthcare.gov before, or ever even gone on and created an account before, if they can think back and try to remember what their username and password was when they first enrolled. I know we all have issues with usernames and passwords for different websites. And then the navigator can help them unlock their account or reset their password if they need to, but it does make the process a lot smoother if you come to the appointment with that information.
Now, in that appointment, is there the ability for the navigator to actually help you sign up to the point where you're clicking done?
Yes.
Oh, yes.
Wow. Because it can be intimidating for a lot of people just to go through that part of it.
Yes.
I find that many people are sort of intimidated by the challenge of what your income is going to be for 2019. And I think they sort of feel, when you sort of tell them, it's okay if you find out your income is going to be higher or lower, here's a phone number you can call, and you can change that.
And why does that matter so much?
Well, people are afraid they're going to get caught with a big tax bill. Because what happens is, some of the folks that we're helping enroll, they might get $9,000 worth of advanced tax credits. And so if they under or overestimate their income, they might actually be getting more money back, or they might have to pay the federal government back more. So it's tied with your federal taxes. And so if people, once they understand, look, this is your best guess. If you find out in April, May, it's going to change, it's going to be up or down, you can call this number and you get it adjusted. So they can do that. And they feel relieved when they do that too.
If you are planning to sign up with that navigator, what documents do you need to bring? Anything?
It's helpful if they bring in information about their income, some paychecks and things like that. Maybe their IRS, not IRS, their income tax from the previous year is always helpful. What else?
If they're not a U.S. citizen, if they have their immigration documents, so if they have a green card, if they bring that, or a work permit, even if they're a naturalized citizen, sometimes it will ask for the number on there. naturalization certificate. So those are all helpful numbers to have. Social Security numbers for everyone in the family applying. So if you're coming to the appointment and you're applying for yourself and your children, you need Social Security numbers and birthdays for all the children that are going to be on the application.
And this is just for folks who are here legally. So if they're undocumented, we cannot sign them up. So, but if they're documented or naturalized or American citizens, they can get coverage. You know, at the beginning of the show, you mentioned it can be make or break for some families. Well, just Monday night of this week, my wife and I and another volunteer, we signed up folks at the Hermitage's Library. And a gentleman came in who I signed up last year. And he shared with us a story just a few weeks after he got his health insurance renewed, because he wasn't sure he wanted to renew it or not. He came down with bladder cancer.
Oh, goodness.
And he had to have multiple surgeries and to get that removed. And he was so thankful. And it was very refreshing to sort of talk to him and get his perspective of how important it was for him.
Oh, absolutely. And I know that there have to be a lot of people sitting at home saying, do I have the money to pay towards premiums? Do I have the money to pay towards, deductibles? I don't tend to use it, but there's always the what if. But you tell a story about that, and it really does bring into perspective, because it can break you financially if you don't have insurance. Absolutely. We're going to take a quick break. When we come back, your phone calls, please, this is the night to call in. If you have questions about the Affordable Care Act, these folks can answer it. I know they can. We've had them on before. 615-737 plus is the number to call. Stay with us.